Hi everyone, I am Shahan Layek. Welcome back to my channel, and in this video I will be discussing about what happens if you take two different vaccine. Basically, two different COVID vaccine. By this terminology, I mean that the first dose you have taken, suppose you have taken Covishield, and the second dose you are taken Covaxin. So two different dose. I don't mean that you have taken the Covishield first dose and second dose, and after 2 years or 3 years you are taking Covishield. So what will happen to that? So that is not the topic of discussion today. The topic of discussion for today is if you have taken the first dose either Covishield or Covaxin, and the second dose either Covishield or Covaxin. So that is the discussion. So let us discuss about this based on a case study. That is a Maharashtra. That is in Maharashtra. There is a man who was in the Jalna district. So Maharashtra Jalna district, there was a man who has first taken Covaxin. First dose was Covaxin, and in his second dose he has been given Covishield. He has been given Covishield. So first dose Covaxin, second dose Covaxin. So what happened to him? Basically, he is under observation. He is under observation, and this patient is being studied. So government is trying to study this case. Basically, what happened to him? There is no such great complication, but a minor complication has happened to him. So before that, let me tell you one thing, that but in UK, basically in the University of Oxford, there is a study, and the name of the study is COMCOV. The name of the study is COMCOV. So this is a study that is done in the UK. In UK, this study has been done. In India, this study is not done. That what happens if anyone takes two different vaccine. So they have actually studied in based on the first dose of AstraZeneca, and the second dose is Pfizer-BioNTech. So the first dose was AstraZeneca, second dose was Pfizer-BioNTech. So these are the two different vaccine. If given in a particular person, what happens? That study is known as COMCOV. That study is conducted by UK University of Oxford. And what is the result? The result is the adverse reaction which are normally happening in any person, that is being increased. So let me elaborate. Like the normal reaction is chills, normal reaction is fatigue, normal reaction is fever, normal reaction is headache, joint pain, all these muscle pain. So all these things are happening normally if you take a vaccine. It may be Covaxin, Covishield, whatever. But if you have taken the first dose of Covaxin and second dose you are taking Covishield, so in that case these adverse reactions which normally happens, this has been increased a lot. So you may get a lot of fatigue, you may get a lot of fever, lot of headache, lot of joint pain, lot of chills, lot of muscle ache, lot of pain in the injection site. So these adverse reaction has been increased. So it is generally found that 10% of these people who have taken different vaccine at different times, they have developed severe fatigue. So their fatigue level is severe. But those patient who has taken 3%, or those who have taken the same vaccine, 3% of them, they have the severe fatigue. So if you have taken the same vaccine twice, so if you are taking the first dose of Covishield and the second dose of Covishield, then 3% of the people are observed to having severe fatigue. So this shows that if you have taken two different vaccine, then you have more chance of getting fatigue, more chance of getting fever, more chance of getting chill, more chance of getting joint pain, more chance of getting malaise, more chance of getting muscle pain, more chance of getting pain at the injection site. So these are the adverse effect which are generally there, but it increases when you take two different vaccine at two different dose. Now this study was conducted in UK, I told you, and this study was published in Lancet. You know, Lancet is a great magazine. It is in this magazine this study is published. Another result from this study came out is the younger population who has taken two different dose, they are getting more affected than that of the old. So old people, if old people has taken the first dose of Covaxin and the second first dose of the AstraZeneca Covishield and the second dose of Pfizer-BioNTech, then they are not having so much problem. But young generation, if they have taken the first dose of AstraZeneca Covishield and second dose of Pfizer-BioNTech vaccine, then they get more affected. So young people who take two different vaccine, they are getting more affected. This is according to the study of UK. This is according to the study of ComCov in UK, and that is published in the Lancet. So remember, British government has studied this on the two important vaccine. One is AstraZeneca Covishield and Pfizer-BioNTech vaccine. But this study is not conducted in India. In India, this study is not conducted. In India, there should be a study on Covaxin, the first Indian vaccine, and Covishield. This study should be conducted in India, but unfortunately in India this study is not being conducted. Let me tell you another thing. From April, the British government has started another study that is known as ComCov 2. The ComCov 2 is the second part of this study. British government has started studying, and the result of which is still unknown to us. The result is not yet published. Another thing, let me tell you about France. Because in France what happened, the first dose was given for AstraZeneca. The first dose was AstraZeneca, but due to some restriction, this AstraZeneca was stopped in France. So public received the second dose of Pfizer-BioNTech. So the second dose was given as Pfizer and BioNTech. So two different vaccine. You can see the first dose was AstraZeneca. After some time it was stopped. It was restricted by the government due to some reason, and the second dose for these person were given Pfizer and BioNTech. So in France this is going on. So they know that some chills, fevers, headache can increase, but that will be mild. So you need to take rest and it will be okay. So in India, but always remember, in India there is no study. There is no study of this. So we need to be careful, because according to the Indian government guidelines, you need to take the same vaccine. If you are taking the Covishield, then the first dose should be Covishield, second dose should be Covishield. If you are taking Covaxin, the first dose should be Covaxin, second dose should be Covaxin. You should not mix the vaccine. You should not take the first dose Covaxin and second dose Covishield, or first dose Covishield, second dose Covaxin. You must understand this. This is the end of this video. Thank you so much for watching this video. If you like this video, make a thumbs up and subscribe our channel for getting many more videos like this. Thank you so much for watching. Bye bye. Have a nice day.